Hi, Deborah. Thanks for agreeing to do this interview with us. Can you tell us a bit about your personal background and nursing experience?
Well, I've been a nurse for 38 years. I graduated in 1974 from the Toronto General School of Nursing, and I've worked in many different areas of nursing, including medicine, critical care, coronary care, discharge planning, interventional radiology, and cancer care.
Can you share with us one specific ethical situation that you were involved with? And please keep the names of any patients and clients confidential along with identifying information.
There was a situation when I worked in interventional radiology a number of years ago, and this particular day we were doing a procedure, coiling of a brain aneurysm, which was a highly specialized procedure, and had the potential risk of the aneurysm rupturing. We hadn't done very many of these procedures, and the other nurse and myself involved in the case were really quite new and inexperienced. As well, the doctor himself had not done all that many of these procedures. On this particular day, we were performing the procedure, and the patient began dropping their blood pressure, and the patient was under conscious sedation. They were not intubated, and we realized that the aneurysm had ruptured. At this point, we knew that we needed additional assistance, and the other nurse and myself said to the physician, we need to call a code blue, a cardiac arrest, so that we can get additional support in the room. Initially, the physician said, no, we can handle this ourselves, get the crash cart, and we knew from our past experience, both being very experienced nurses, that we did need the additional support of a respiratory therapist, an anesthetist, and just additional physicians on hand to help with this potentially fatal situation. We did overstep the boundary of the physician and said, we are calling a code blue. The team did arrive, and we did get the patient stabilized. This choice, I guess I would feel that I was advocating on behalf of the patient. The patient was not conscious. Before our eyes, we saw that she was deteriorating, and it was, I don't know if it was really questioning the authority of the doctor. I think the doctor was traumatized himself, and maybe he was not making the logical decisions. Maybe he felt that calling a code was admitting that he was not handling the situation. He could not handle it himself, but indeed we did need, the other nurse and I decided together that yes, we did need to call the code blue.
And can you describe the process of ethical decision-making that occurred? Were you actively engaged in either making the decision yourself or supporting the client, patient in their choice?
Well, as I said, the patient was not we were advocating for the well-being of the patient, and so I guess it was a decision between myself and the other nurse present.
And was this a conscious decision, or was it part of your normal reflexive nursing practice?
It would be a decision I would make in any situation where I deemed the safety of the patient was at risk.
And can you describe how relational ethics were demonstrated by you as the nurse?
Well, relational ethics, when you think about general conversation, promoting the well-being of the patient, the relational ethics, I think, almost came into play after the situation. Once we had the team there and the patient stabilized, the relational ethics between the physician and ourselves, we were able to talk out, and he did admit, yes, we did make the right decision in calling for help. Although we felt in part that being nurses questioning the authority of a physician, we had maybe overstepped our boundaries, but he admitted later on that what we had done was the right decision.
So do you feel you acted alone or in consultation with others?
I acted in consultation with the other nurse who was present, who I had a long-standing working relationship with in this area, plus in another area where we together previously had taken care of critically ill patients, and we were used to the sequence of events when a patient is deteriorating, the steps that need to be taken.
Can you describe any significant memories or ongoing feelings that you took away from this experience?
Well, I think what ended up happening was after the whole the experience was ended, and in the days following, we did have meetings to discuss what had happened, and we agreed that in future situations we would use additional medical support doing these procedures. For example, we would have an anesthetist present in future procedures, and this actually did pave the road for safer practice.
Did you feel that the ethical dilemma was resolved by the actions you took or your way of being with the patient?
I feel that we did make the appropriate decisions, and so really there really shouldn't have been a dilemma in the first place, because the decision that we made to call for the extra assistance, even though the physician initially said no, it was the right decision.
So what did you learn from this experience overall?
I guess just in general, I learned that no matter what the outcome, if you have a gut feeling that a decision you are about to make ethically, whether it's right or wrong, if you have the patient's well-being at heart, it is always best to go with your experience and advocate on behalf of a patient, especially if that patient is not able to speak for themselves.
Great, thanks. Do you have anything else that you'd like to share with us that might be helpful in our learning about ethical nursing practice?
I would just say in general, ongoing open conversation and strengthening relationships amongst all of the team, your co-workers, as well as having a good understanding of your patients' needs, and open dialogue, what patients are asking for as far as their cultural beliefs, their physical and emotional needs. That way you are able to support them in their journey.